Hello, my name is Kevin Antolowski. I'm a senior at Bloomsburg University and a criminal justice and political science major. I am covering the Ebola epidemic and resurgence. Why does this matter? There has been a resurgence of Ebola in the Democratic Republic of the Congo in recent years. This disease spreads from contact with the infected person's body fluid. This disease also has an extremely high mortality rate and can reach 90% in some instances. There is no known cure or vaccine for the disease. This virus first came into the news headlines in 2014 in Western Africa during an outbreak that took the lives of 11,000 people and had 28,000 confirmed cases. Ebola is a virus which is considerably more difficult to treat than bacteria. Symptoms generally appear within 2 to 21 days of exposure to the virus. Early symptoms include fever, fatigue, joint and muscle pain, headache, sore throat, and a cough. With disease progression, symptoms include vomiting, diarrhea, rash, unexplained bruising, internal and external bleeding, and weight loss. What are the causes of the Ebola virus? Ebola can primarily be found in animals and primates, especially fruit bats. This virus can spread from animal to person and person to person by direct contact with bodily fluids, feces and vomit, organs of infected people, contaminated surfaces, breast milk, and sexual contact. Cure and treatment. There is no cure or vaccine for the Ebola virus. Symptoms are generally treated as they appear, and early intervention can improve the chance of survival. Treatments include intravenous fluids and electrolytes to keep the person hydrated, oxygen therapy, medicine to manage blood pressure, diarrhea, fever, and pain, as well as treating other infections as the immune system is weak. This is a map distributing the deaths from Ebola virus since 1976 to 2014. Notice at the end of the timeline, there is a sharp spike in the number of deaths. These figures constitute Ghana, Liberia, and Sierra Leone and their outbreak that occurred in 2014. 843 people died in Guyana, 2,454 people died in Liberia, and 1,183 people died in Sierra Leone from 2014 to 2016. This map specifically depicts the Ebola outbreak from 2014 to 2016. It highlights the severity in which Sierra Leone, Liberia, and Guyana faced the Ebola virus. This map details the 2019 outbreak in the Democratic Republic of the Congo. There have been nearly 500 reported confirmed cases of the Ebola virus. What factors can explain the transmission of Ebola across nations despite containment efforts? Slow recognition of the disease is an obstacle. In 2014, the countries affected most by the disease were unable to recognize it, as they had not dealt with it in their part of Africa before. Weak healthcare infrastructure is also a problem. Third world countries also lack healthcare workers to provide care for the sick. Political instability, due from panic of the outbreak or even civil wars, is also an obstacle of bringing effective aid to those who need it. Cultural practices and traditional beliefs are also an obstacle in some way to containing the outbreak. Because of this, unsafe burials have been accounted for nearly 60% of the spread of the disease. High population in afflicted areas and lack of sanitation is also an issue. Borders in this part of the world are also relatively unsecure, Air travel from aid workers is also a problem. Ebola also changes its genetic structure quickly and is hard to combat. What was the world's response to the 2014 Ebola virus outbreak? The United Nations created an emergency health mission for the first time ever. The UN also appointed a special envoy on Ebola and established the Global Ebola Response Commission. This is a committed group of organizations dedicated to collectively provide strategic coordination and play a concerted role in the Ebola response. The World Health Organization declared, "The outbreak in West Africa will end when we get to 0 cases." Their initial game plan was to stop the outbreak, treat the infected, ensure essential services, preserve stability, and prevent further outbreaks. However, this issue has resurfaced once again in 2019 with over 500 confirmed cases of the Ebola virus in the Democratic Republic of the Congo. All of these same risk factors are prominent in this area of the world, and an outbreak could have devastating impacts on humanity.